Governor, based on what we know about early brain development and the impact of adverse childhood events, what are your thoughts on improving early childhood well-being and reducing the number of children who enter the child welfare system, many of whom are aged 0 to 2?
Yeah, so the ACEs study that is, I think, incontrovertible, indicates that the more trauma that a really young person sustains, the more difficult their life is going to be, and I certainly accept that. So I will tell you what we're working on through the work that Secretary Marquita Walters and the Department of Children and Family Services are doing. We were the first state in the nation to adopt the quality parenting, it's a QPI, so that we're actually working with the birth mothers, but using the foster parents so that they maintain a relationship with the children, but it's a healthier relationship while we give the birth parents the tools that they need to be better parents and take better care of their kids, because 75% of the kids are going to exit foster care and go back to their birth parents. So that's critically important. I will tell you, we've also, Donna, the First Lady, and I, we've initiated Louisiana Fosters, where we are engaging the faith-based community, but also the business community, nonprofit sector, and other stakeholders and advocates to make sure that we're doing everything that we can to support foster parents across the state of Louisiana. We, this year, extended the age of foster care to 21, which is incredibly important. It's also important that we have, for 3 years in a row, set all-time records for adoptions out of the foster care program. So there is no doubt that we have to do more for our children, especially those who are most vulnerable, those who are in households that, at least at times, are dysfunctional, by protecting the children and giving the parents the tools that they need to be successful. But the focus always has to be on doing what is best for the children, which is the legal standard, doing what's in the best interest of the children. We're going to continue to focus on that, and I believe we made considerable progress, but I'm the first to admit we have a ways to go.
Many working families struggle to afford high-quality child care for their children, including both young children and after-school programs for older kids. Do you believe this impacts the economic and workforce development of the state? And if so, what are your plans to help families get the child care they need for their children?
Yeah, well, first of all, there's no doubt. There are many parents who could work, but not for a wage that makes child care affordable. So if they have to pay for child care, which can be extremely expensive, then they're not going to work. The other thing is, we know that the child care in many cases needs to be there for the child as well. And so we've taken this very seriously. In this past session, for example, we increased the total annual investment in early childhood education by $20 million. We fully replaced an expiring federal grant that exceeded over $8 million. And the remainder of the $20 million was to secure more seats in quality early childhood education and child care, but also to increase the amount paid for those seats to the 25th percentile, which is something we were required to do by the federal government. But because we're paying more per seat, we're also able now to insist upon more quality, more education. The 80% of a child's brain development happens in the first 5 years. And so you can't wait till a child shows up in kindergarten or first grade in order to engage that child, because by that time, too many of our children are starting school, but with a vocabulary deficit in the thousands of words and other deficits as well, math, and they don't know shapes and colors, days of the week, months of the year, things of that nature. And what we don't do very well is catch them up. But by the way, no state catches up the kids very well. We just have more than our fair share of kids who start school unprepared. So we know that early childhood education is critically important. That's why we made the additional investment this year, and why the number one investment for new priorities in the second term will be early childhood education for me. We know we have to do a lot more in this area.
Given that 71% of Louisiana third graders cannot read on grade level, would you support legislation and funding to equip educators in kindergarten through third grade with evidence-based reading practices to ensure that Louisiana students become strong readers?
Absolutely. And by the way, we're doing that. So this year we had the first net new investment in higher education in 10 years. But with respect to K through 12 education, we didn't just give the pay raise for teachers and support workers, although that's critically important that we did that, even though the pay that goes to adults, the investment is in the children. But we also increased the block grant portion of the funding formula for K through 12 education by $39 million. This is funding that we provide directly to the districts. And we didn't tell them, okay, now you have to use your $39 million to pay for the related benefits costs for the pay raise. And we took all of that upon the state of Louisiana. So that $39 million is available to the districts to be invested directly in the classroom to the benefit of our students, which is by law where 70% of that additional funding has to go. I am committed to continuing to do that. And when you better fund the school districts and you take that pressure off of them, then you are going to be more successful when you engage them with the evidence-based learning. For example, you were talking about reading, which is so critically important because there's a cost associated every time you change and adopt a new program, because you have to then go in and train the teachers, you have to buy the material and so forth. And so this investment that we're now making again in K through 12 education will facilitate a move towards stronger, more evidence-based programs in reading up through the third grade, as you just mentioned, critically important for our future.
According to the Georgetown Center for Children and Families, Louisiana currently leads the South in healthcare access for children due to Medicaid expansion. What will you do to ensure that all children continue to have access to healthcare services they need?
Yeah, well, critically important, obviously. We actually have the third highest rate of insured children in the country. We don't just lead the South, we're number 3 in the United States of America. We had that large percentage of our kids insured because of the CHIP program, LaChip, but also we know, and evidence has shown, that when parents sign up for Medicaid expansion, they now know about the Medicaid program and they will sign their children up if they weren't already signed up. That's why we have this huge percentage of our children with health insurance in Louisiana. That is really important, and it also helps us to make sure that we're providing reimbursement to the providers across the state of Louisiana for the care that they deliver. That allows them to deliver more care and keep their doors open. For example, we have not had a single rural hospital close in the state of Louisiana. And that's critically important, not just for the critical care in a hospital emergency room, but more and more often hospitals are running their own outpatient clinics, including pediatric clinics like I saw in DeSoto Parish just this past week. So without the Medicaid expansion strengthening the hospitals, you wouldn't have that pediatric program in DeSoto Parish. And then you would have children with no pediatric program, period, unless they traveled all the way into Shreveport, for example. So we know this is critically important. Expanding Medicaid was the easiest big decision that I will ever make for many, many reasons that I can't get into in the amount of time I have to respond to this question. But there is no doubt our children are benefiting. They're also benefiting because their parents have coverage and now they can be healthier and they can continue to work and support themselves and their families, whereas before, when they got sick, there was a good chance they would no longer be able to work. And in many cases, quite frankly, people get an opportunity to live because they're being diagnosed with cancer and hypertension and diabetes earlier. They can get the treatment that they need, they can live. That's certainly important for their children as well.
Low-income working families pay the highest percentage of their income in state and local taxes, making it harder for them to afford basic necessities. What are your plans to make Louisiana's tax structure more equitable?
Yeah, well, first of all, we have about the 5th lowest combined state and local tax burden in the country. That's what we had when I became governor. I think it's number 5 today. Number 4 or 5, depends on which study you look at. But there is no doubt that, in my opinion, and I said this over the last several years, we're too reliant upon the sales tax, which is regressive by its nature. However, we need to be mindful that in Louisiana, we do have a very generous constitutional exemption that benefits especially those in the lower income area of the state, and that is the sales tax exemption for state sales taxes on groceries, utilities, and for pharmaceutical drugs. Altogether, these exemptions exceed $1 billion off of that what would otherwise be paid in sales tax and certainly benefit the working poor, for example. So I insisted as we look for ways to address the $2 billion budget deficit that I inherited, the largest ever, that we not touch those exemptions, and we did not. Further, as soon as we were able in 2017, we reduced the sales tax from 1% to 0.45%. At the same time, we granted a 40% increase in the earned income tax credit to try to make work for the working poor. That 40% increase in the earned income tax credit is the largest in the history of our state since the program was created. Now, it is true that the commission set up by the legislature to study and recommend tax reform recommended about 15 or 16 different approaches, things that could be done, all of which were introduced into the legislative sessions, special sessions, and regular sessions, and not a single one was passed by the legislature. And in fact, it was the House of Representatives who refused to do any of that. I'm going to continue to work, however, to make sure that we have a fairer, more equitable tax system in the state of Louisiana, and that's something that I'm never going to give up on, and we're going to have opportunities in the second term as well. But I'm also at the same time going to make sure we protect the exemptions that benefit working poor people, and we're going to protect their earned income tax credit as well.
Do you believe that Louisiana spends enough money on its children? And if not, what are your plans to increase funding?
Yeah, well, as I mentioned earlier, the number one new investment in a second term in terms of my priorities will be additional funding for early childhood education. It is critically important that fewer kids start school in a situation where they're not ready to learn. That's how we're going to close the achievement gap. That's how we're going to have the educational outcomes that we want. And that's going to ensure opportunity and prosperity for generations to come. We put a down payment on that this year, $20 million more for early childhood education this year compared to last. But we also invested more than $140 million more in K through 12 education. $101 million of that went to teacher pay and support worker pay, but also a $39 million investment in our districts themselves, 70% of which has to go into the classroom for our kids. And I think it's notable that we had the first net new investment in higher education in 10 years. We had the largest disinvestment in education and higher education in the country under Governor Bobby Jindal in the 8 years before I became governor. As soon as I became governor, we stabilized the situation, and this year when we were finally able to do so, there is a net new investment. So I believe in investing in things that will benefit our children. I think that that's critically important. I often say it, our children are our most precious natural resource, and we have to do everything reasonably within our capability to nurture them, to educate them, to set them up for success. And when we do that, we're going to have prosperity in Louisiana like we have never seen, and I am confident that we're on a much better path today to making that a reality, and I am committed to ensuring that we continue to move forward and do better over my second term as well.